What's going on? Dave Matta here, founder of PT Biz, and today we're going to talk about how you can nail the first visit. So one of the most important touch points you're going to have in your business is going to be the first visit you have with a patient when they come in. And for many of you, you come out of the world of in-network physical therapy. You don't have that much time with people. You might have two other people that are out working with, maybe a tech in the gym as you're going through an evaluation. And the amount of time that you get in these low volume cash-based clinics in comparison to a high volume in-network clinic is so different. And it allows us to structure a evaluation in a really unique way, a really helpful way for the patient. But also, I'm going to walk you through the best way to structure a visit for you as well, not necessarily to get buy-in from your patient in terms of, wanting to work with you and wanting to commit to solving a problem with you financially, but also how to really get clarity for them so that they know what's going on and they feel very clear about what the next steps are and the work that they're going to need to put in, right? Because in the end, we want to get them the result that they want, and they want to get the result they want. And the number one thing, and this is super, super important, it's probably the most important thing that I'm going to say. The first visit is not about you trying to prove to somebody that they made the right decision. The first visit is about clarity. People lack clarity, especially with their body. Like health and wellness and injuries, it's so confusing. There's so many different opinions of what's going on. And if they can have clarity about what's going on and the path to resolution of that, to solving that, they're going to trust you and they're going to do what you say in terms of your home exercise plan, compliance, all that be so much better, as well as be very clear about what it takes and why they might want to work with you to solve that problem, which means them actually investing in working with you to do so. So the common misconception for most people is that all you have to do is just give them a bunch of stuff, right? Do a bunch of tests, throw a bunch of confusing words at them, make it seem like you're smart, and then you're good to go, right? And that is actually not the case at all. The truth is clarity is what people need. So remember that. It's not about trying to jam everything into one visit. It's about trying to actually create clarity for somebody. And there's a very specific way we can go about doing this. And I'm going to talk through the different portions of the initial evaluation and what you can do that really drives home a fantastic outcome, right? So let's do this. Let's go to the iPad and we're going to draw some of this stuff out. So, okay, number one. So we have our first visit. They've decided they want to come in and work with you. That's step number one. That's obviously huge. And if you want to know how to, why the first call is so important, we'll link to a video I did on that as well, because they have to get here through probably an initial conversation with you. And that's a very important conversation as well. But this is once they're in your office, right? And this is now you get your time to shine, right? You're a fantastic clinician. You get to show them what you know. So when we look at easy wins really come down to the beginning of the visit. So these easy wins are a few things. Number one, you are on time. These easy wins are free, by the way, but you're on time as best as you possibly can. And the thing is, yeah, things pop up, whatever, but you can control your schedule much better than you think, especially with low volume. So being on time and being punctual shows that you respect other people's time. And if you want to differentiate yourself from a traditional medical visit, be on time. How many times have you gone to the doctor, dentist, physical therapist, and they're late to see you? Don't do that. This is an easy win. It makes you look really good. Number two is rapport. So you have time to talk to somebody. Hey, how's it going? How's your day? What did you do this weekend? What part of the city do you live in? Talking to them about themselves, about how they got there. And very importantly, don't forget this question. How did you hear about us? This is actually super, super important. How did you hear about us? I would love to thank someone if they sent you our way. And I would love to know how you heard about us and ended up in my office. Maybe it was a Google search. Maybe they saw an ad. Maybe they saw something on Instagram. Maybe a friend told them about that. And if it did, you always want to make sure that you know who that friend was and you thank that person via email, text, next time they're in the office, whatever it is. How did you hear about us? Great. I would love to thank that person, for recommending us. That's huge. And that will help you snowball more and more of these word of mouth referrals. And the last thing, and this is another super free, easy thing to do, is use their name. Everybody loves their name. Everybody loves it when you say their name, right? If somebody comes in and you say, hey, Brian, nice to meet you. So excited to work with you. The person's name goes a long way, and it's on your freaking EMR. Like, it's right there. You don't have to remember their name. You have to remember everybody's name. It's literally on your EMR. You see it on your schedule. Use their name. Okay. These are easy wins. This is not even a part of the visit really, formally, but it's a huge part of building rapport and starting off with a good first impression. Okay. So let's talk about the subjective. So in the subjective, I'm not going to tell you how to actually run a subjective visit from a clinical standpoint. I expect that you already know that. But what I'm going to talk about is the elements of things you want to have in your subjective. They're going to help you get buy-in, clarity, and really put yourself in a position to have your medical opinion be taken, very seriously in terms of what the plan of care is and why someone would want to commit to that. So in the subjective, you want to make sure that you are listening. Okay? You are not talking the whole time. You are listening to them. You are asking them, obviously, the pertinent questions about how this started and the symptoms, and you're ruling out red flags and the things that you need to do from an actual, medical standpoint. But you're listening to them and you're allowing them to tell their story. And in some cases, to air their frustrations, to get them out about all the crap that they've been dealing with and the things they've had to avoid and the things they've tried and why it's not working. And it's so frustrating for people to have injuries that stop them from doing things they want to do, and also to kind of get stuck in the healthcare loop that can be frustrating, and they get bounced around and referred to other people that don't seem to really help them. So listen to them. Let them air their frustrations. Let them get it out. It's not a waste of your time. And when we're in clinic in a high volume setting, it can feel like a big waste of time because you're like, oh yeah, okay, we got to move on because I don't have that much time, right? Like, okay, cool. Let's just skip that part and let's get right into these things I have to check off, and then get into the objectives so we can get an idea what's going on and figure out how we can help you, resolve that. But we're missing out on building this trust with a patient that's so, so important. And allowing them to have the time to be able to express what's going on makes a huge difference. So let them talk about what's going on. Let them explain their story. And then you want to make sure that you are asking why, okay? Not necessarily just why are we here, right? Or what are your goals, but why is it important to you? So for instance, I had a patient one time, and she came in because she had a knee problem from running. Okay. So the problem was running pain, right? In the knee. Now, this is why are we here? I have pain in my knee when I run. Okay. Why is running important to you? It's how I manage weight. Okay. That makes sense. This is how you manage your weight. It's how you get your conditioning in. Well, why is the management of your weight important to you right now? Like, do you feel like there's some health stuff you need to work on? Is there something important coming up? Yes, actually, I'm in a wedding in 2 months, and I run to manage weight, and I have to fit into a bridesmaid's dress in 2 months that right now it's a little bit tight, and I got to make sure that, I can do that. I don't want to be embarrassed by that. This is a different level of communication we're talking about. If I just left it here at, you have knee pain when you run. Great. We help people with this all the time. I could have done that. But instead, I want to know, well, why is running important to you? Is it your community? Is it a way that you manage stress? In this scenario, it's how she managed her weight. She wasn't in my office because of knee pain. She was in my office because she had 2 months to fit into a bridesmaid's dress that she was worried she wouldn't be able to look good in. That is a different level of understanding why somebody is doing things. And that helps me tie the things that I'm going to ask her to do, because I might say, cool, let's not just talk about running. Let's look at some simple things we can do to help manage inflammation, as well as manage weight, that can be, easy, low-hanging fruit things. They can also help us heal and help us, lose some weight at the same time. Now I can tie these things back in together because I understand her why. So one of the biggest mistakes that I see is people do not actually ask people about their why. They just ask, why are we here? And they leave it at that. And you don't go 2, 3, 4, 5 levels deep to understand why somebody's actually wanting to work with you, and then make sure that they're actually going to stick to that. Okay. So that is, that's the subjective. A big portion of subjective is asking the right questions, asking the why questions and listening to them. The other thing is you can slow down. Again, you have the time. Slow down. You have the time to make sure that you're listening to people, that you're letting them tell their story, and that you can actually ask these questions and build some rapport. Right. And they finally have a chance to let this out. And it can be a huge reliever. In fact, this is the area of the visit where most people are, if they're going to get emotional about why they're there, this is where they're going to do it. And honestly, people getting emotional in your office about frustrations they have is a good thing. What a great thing to let them, let those things out, to not have to hold those in, to not have to hold in these fears and frustrations that maybe nobody's listening to them about. And that's a great place for you to be, because you're helping this human being in front of you who's obviously stressed out be able to finally get that off their chest. And that affects them in a really positive way in other ways as well, not necessarily just with our plan of care that we're going to, try to help them through. So that's the subjective. Listen and ask the why questions. Now, when we look at objective, you're obviously going to go through your tests of whatever you think is going on. You're going to, it depends on, whatever your background is in, right? If you're kind of come from my camp, where I come more from like the ready state kind of Kelly Starrett approach, a lot of tests and retests I really like a lot. If you're coming from, the PRI camp, if you're coming from more of a manual camp, you're a Maitland based, doesn't really matter, right? I don't really care what your background is. Here's what I can tell you that is going to help you get buy-in and clarity with somebody. And that is being thorough and explaining to them what's going on throughout the process. And for me, this always came down to tests and retests. All right. And the reason I like these is because seeing is believing. Okay. When people can see that something is improving, that symptoms are, maybe they're getting worse with certain things, getting better with certain things. Range of motion is improving temporarily. We know that, like, if I do breathing drills with somebody, I can improve a forward bend by, inches sometimes, right? You can literally do things that people don't think correlate. You can have somebody, mobilize the bottom of their foot with a little crossball and improve a forward bend. Here's the point with this. Yes, these are transient, and maybe these have nothing to do with their treatment plan. But for me, if I know, okay, if I get somebody to do some breathing work and that improves their forward bend, it's obviously something I want to include in part of my treatment plan. But if they see that I can literally have them do some positional breathing and all of a sudden they can bend forward further and their back doesn't hurt as much, now when I tell them that we need to do these weird little breathing exercises, they're far more likely to do it. Not only that, they think you're some kind of a magician because you've now helped improve a pattern that they literally had pain with for who knows how long. This is something that is very powerful when it comes down to somebody committing to solving a problem with you and thinking you're the right person. Keep in mind, you may be battling the ghosts of who knows how many other healthcare providers they have worked with that hasn't worked out, that have told them, oh, I can help you with this or that or whatever it might be. We used to always think of ourselves as like, we're like the cleanup person. Very rarely are we the first person that somebody has seen. Like, they're going to go to any number of other people that are probably cost less, that are going to be in network or are going to be, recommended by their physician or something like that they saw first. So we're having to show that we know what we're talking about. And one of the best ways to do that is to test and retest things. So test something, retest something. It also shows that you have a system in which you are actually following to work with somebody. So whatever it is that you do, make sure that you follow a system, make sure that that approach is repeatable, and that you're communicating along the way with what is actually going on with that person, right? And for them to understand that. And when they see and feel a difference in something, that's very, very powerful for you, because it shows them that seeing is believing. This person not only listened to me, now they're testing things. I'm starting to feel better. I'm starting to move better. Like, I'm starting to feel confident that I can make this change that maybe I thought I wouldn't be able to ever do again, right? Like that's what people are thinking. And you're helping them break those false beliefs to then they can actually get back to the things that they really want to do. So in the objective, it's really important. You do your thorough assessment. You're dialing in what's actually going on, but along the way, you're educating them by doing tests and retests. The other thing, and this is really important, is you have to educate. And one of the best ways to do that is to draw. Okay, so this is something that I picked up working for the Starets through the Ready State program, and this is something called the I3 model. Okay, so this is the I3, and this is something that I would draw out for basically every single patient that I would see that was a new patient. So the I3 model, and you can feel free to steal this. I didn't come up with it. This is from Kelly Starrett. This is how we would explain why we have things going on. In particular, people that had injuries that were associated with minor things. Like let's say somebody hurt their back picking up a pillow or something really light, okay? So I3 is this. It's incomplete mechanics. All right, incomplete mechanics is number one. And by the way, if you're listening to this on the podcast and you want to see the video version of this, head to YouTube, to the PT Biz channel. We're putting a lot more resources into educating there so that we can actually have a more profound education platform, and you can see some of these things as we're actually like drawing these out. So incomplete mechanics is number one. All right, then we have incidents. All right, and then we have injury. Okay, so this is the I3. Now, here's how I would explain these things, and I would draw these out. I would draw these out and actually explain this as I was going through this on a whiteboard or a piece of paper or whatever it is that you have, okay? So let's say somebody comes in and they hurt their back picking up something really insignificant, a pillow, a Amazon box, whatever. And you say, okay, here's where we're at. You have an injury, so you're here, okay? You now have an injury, but what happens is that injury happens off the back of incidents. Okay. Now, incidents, think of incidents as minor irritations that happen because of, things that we're stressing because of either lack of strength, lack of control, a combination of the two things, lack of mobility, whatever it might be. And you're finding these things on your objective assessment, by the way. So you're taking your findings from your objective assessment and you're now layering this into your I3 model to show them where this fits. And the things we find in our objective assessment are the incomplete mechanics. So if I'm talking to somebody and I say, listen, you hurt your back picking up a pillow. The pillow's not the problem, right? Don't be afraid of pillows for the rest of your life. You have an injury now. You have hurt your back. But that injury comes from incidents. So we're here. These incidents are minor aggravations you have to the musculoskeletal system, the nervous system, whatever it might be, that they're not major, but they're compounding. And what we don't know is how many incidents do you get before you have an injury? Don't know. Everybody's different genetically. Everybody's movement patterns are different. Everybody's connective tissue, resilience can be different. Who knows? All we know is everybody has a number, whatever that number might be. You hit your number when you picked up the pillow. That was the last straw event. That last straw event created the last straw that led to the injury, the symptoms you're feeling right now, and all the frustrating things you're dealing with. But the root cause is the incomplete mechanics. It's here. And that's because you have, lay it out for them. You have super stiff hips. You sit all day long. You have no ability to, access your hips when you're lifting things. So your back is having to be used as your hip, right? And what we need to do is we need to get your hips moving like your hips, and we need to get your back being used like your back, and not have your back be your hips, because it's not designed to be like that. And if you keep doing it, you're going to continue to have problems here. So we need to fix this. We need to fix the incomplete mechanics, right? Because if we don't, here's what's going to happen. I will help you reduce symptoms and pain, and then essentially we are resetting this area here. So you're going back to now you've reduced your incident clock down to a lower number, but it will start to compound again, and eventually we'll be right back here with another injury. And we don't want that. So in order for us to stop the injury from happening, we have to fix the incomplete mechanics, which we've now found, and we have assessed and narrowed down what is going on. so that we can fix the incomplete mechanics, which stop the incidents from occurring, which stop the injury from occurring after that. Does that make sense? I have said this same example to I don't even know, literally thousands of people. And it works really well for them to understand, oh, this is why I'm having a problem, the root cause. And how many times is it that we see somebody that has a knee problem and it's not their knee? It's their foot and ankle, it's their hip, it's their spine, whatever. But to the average person, that is a hard sell. Like no, my knee hurts. You're telling me my knee is actually fine and that I have a bad ankle or whatever that needs to be addressed? That's a tough sell, okay, for the average person. But it might be the truth. It might be exactly what they need to do. So if you can dial that in for them and you can help them learn this, your buy-in skyrockets, okay? And people learn really well from this. There's actually a book, it's called Back of the Napkin, and it's about how you can use images and drawings and examples like this to help with buy-in and education. And it's massively helpful. Most people are visual learners. They see these things, they're like, oh, that makes sense. Versus if you just said this out loud, it probably would make sense, but not nearly as much, and it wouldn't have as much of a sticking factor as people that you draw this out for. So draw things out for people. Use a whiteboard, use a piece of paper. This is so big. And it doesn't take that much time, and it really helps you dial in what's going on the objective side of things that you've now just gone through to then bring that back to what you're going to have somebody do, which is going to be your home exercise plan, right? So when you give them their HEP, here is a huge mistake that I used to make that I hope that you don't make. And hopefully listening to this, you stop doing this if you're doing it right now. And that is, you have to make this really simple, okay? On the first visit, I'm talking 1, maybe 2 exercises. That's it. Not any more than that. What I used to do is I used to think the more stuff I could give people, the more value I'm giving them, right? So I would rush through the subjective, rush through the objective, do as much hands-on work as I possibly could with somebody, and then I would give them like 6 weeks of a program that I would write out that would literally take me like over an hour to put together after they left. Now just think about that for a second. If you're the patient and you're coming in and you have no really medical understanding of what's going on, and I do all that, I give you a ton of information, and then I give you 6 weeks worth of stuff with progressions that you need to do on your own, how good of an outcome do you think that person is going to get? Like, that person has to be super dialed in, very, very, strong compliance on their own, and at least some understanding of movement in order to do everything correctly. The average person is not going to do well with that. What the average person needs is clarity and simplicity. They need clear on what's going on. Here's the next step. Strip it down. Do less. Okay, like you ever seen Forgetting Sarah Marshall, where they're like going out to the surf lesson, and Paul Rudd is like teaching them how to surf, and he's just like, no, do less. Do less. Like, that's what you need to think of. Like, and Ian, throw the clip in here. Like, that's what you need to think of is do less. Do less than you think, and be clear about what's going on. So 1, maybe 2 things. You're going to show somebody how to do this. Okay, you're going to make sure they understand what's going on. And then we're going to follow up with that to make sure that they actually understand. So do less, 1 to 2 exercises. That's it. Keep it very simple. And then what you're going to do is you are going to give them a pop quiz. So pop quiz. What are you going to tell your significant other? What are you going to tell your brother? What are you going to tell your friend? What are you going to tell your roommate that's going on with your back in this scenario, right? Why are you having back pain? What's going on? And what do you need to do to resolve that? I'm going to ask them this before they leave my office. And if they can't tell me what's going on, they're not leaving until I know that they understand what's happening. Because I need to understand that I got through to them, that they understand what the heck is going on with their body. Because the reality is they've gone probably lots of other places and no one's ever explained it to them. Now, all of a sudden, it's very, very important that you quiz them and say, tell me how you're going to tell your spouse, what's going on with your back and how we're going to resolve it. Cool. Let them explain it. And if it's spot on, perfect. Awesome. Here's the deal. I'm going to follow up after today with an email. And this is really important. So you want to follow up email that gives them a summary of what's going on, as well as whatever it is that they need to do for their homework, or if you're going to manage that in a separate, home exercise plan app, that's fine. Whatever you're going to do, explaining all that stuff in an email. So listen, great job on the pop quiz. You passed. You don't have to actually remember anything, because I'm going to follow up with a detailed email that's going to be very simple, but very, very well laid out. So your significant other could even just read that, right? And you're going to know exactly what's going on, as well as what the next steps are. Because in that email, I want a summary. I want their HEP, or however they're going to access their HEP. And then I want the next steps. The other thing you want to make sure you're doing is you're pre-framing anything that might be a step backwards. So let's say that you dry needle somebody on day one. We know they're going to be sore, right? They're going to be sore for, could be a couple days. So I want to make sure I tell them in the office and in the email. I want to say, hey, just like we talked about, don't forget, you're probably going to be pretty sore. That's normal. That's normal when we do this. You're probably gonna be sore for the next 48 hours. After that, we expect this is gonna feel a lot better. And if you don't say that, and they're just like, oh, this is getting worse. I think he messed me up. I don't know if I did the right things. I don't know if it's the right person to help me. Like, you leave it open for interpretation versus making sure they know, hey, I fully expect you're gonna be sore for the next 2 days, okay? Just so you know, like, that's normal. If you need anything, this is how, just reach me, email me right back here. I'm going to send you a summary of what's going on, and they're going to have a lot of clarity around what that is, as well as what the next steps are. Okay. So let them know, I'm going to send you this. You send it to them after the visit. And then the last thing, or last part of the visit, is really the solution. Okay. And this is where everybody actually starts to feel really weird. Like, when you start to talk to somebody about what it costs to work with you, money makes everybody feel weird as clinicians, okay? But here's the thing. I don't want you to think about it as, what is this going to cost? I want you to think about this as, what do we need to do to get the outcome that you want? What's the solution to this problem? Okay? So if I say, listen, Brian, you have, back pain that has been, it's like pretty bad right now, but it's chronic. It's been going on for a long time. And you have these sort of bouts where it comes and goes. And for a month or so at a time, it really restricts you. So this is what we consider a chronic problem with these acute bouts that are occurring. This is something that is not going to be fixed overnight. I'm not going to see you 1 or 2 times and this is going to go away. This is not a simple problem. We literally have decades of stuff that you have been doing that we need to help you correct. And we need to make sure that you make those changes for the long term. And we fix the incomplete mechanics and the root cause of what's going on. I've seen a lot of people that have had this similar problem. In my experience, here's what I see. It takes about 3 months for us to resolve this problem. In the first month, we're going to see you probably once a week, ideally, right? There's a lot of hands-on work that I'm going to need to do to really start to alleviate some of the pain you're feeling and really help you move better and start feeling a lot better, which is going to allow us to do a lot more of the hard work we need to do, which is going to be certain exercises that I'm going to build out for you, where it's going to start to feel almost like a mini workout. And once we do that, you're going to start to spread your visits out a little bit. So instead of every single week, maybe it's, every week and a half to 2 weeks, as we give you more time to build up your exercises, and we have you come back in so we can do more hands-on work and we can progress your exercises and make sure we're coaching you up and do everything appropriately, as well as holding you accountable to these changes you're going to have to make. Because we're also going to talk about, how do we improve some of your sleep, which we need to do? How do we improve some hydration you have going on? How do we manage some of the stress better? Like the breathing stuff that we worked on is a huge part of what we're talked about. These are all things that I want to be able to teach you and educate you on that are going to help make a meaningful difference in your health and eliminate your back pain long term. Okay. In order to do that, we're looking at about 3 months and probably somewhere around 8 or 10 visits. My suggestion for you is that you do a 10 visit package with us. It's going to be the best price per session for you. And it's going to allow us to actually build out our entire plan of care and hold you accountable to sticking to that actual plan of care, which I want to make sure that you do. Because most people, what happens is we're pretty good with our hands. And after the first couple sessions, your back pain is probably going to be pretty much gone. And you might think, oh, problem solved, this guy's amazing. But the reality is it's not. I've just resolved some of the symptoms. I haven't actually created a long-term problem because or solved a long-term problem because I can't do your exercises for you. Like I can't go to the gym and bench press for you and get your arms bigger, right? Like you have to do that. You have to do this work and we have to build the right things for you, which we're really good at. And we have a great track record with this, but this is my recommendation. And then just be quiet and say, this is what I recommend. This is what's going to get you the best outcome. Don't think about, can they afford this? Like, what's the, all these other, circumstances that you might have running through your head and you start to feel weird about it. What is your medical opinion of what this person should do? That is the recommendation you give them, and then be quiet and let them make the decision. Don't make the decision for them. Don't talk them out of it. And this is a huge problem that I see where people are like, well, we could do this or that, or like, let's just see how it goes and then we can decide from there. It's like, no, dude, be a professional. If you have worked with people like this, what is your opinion? Tell me what I need to do. I do not want somebody who's wishy-washy and I don't know, it could be this, whatever. Just remember this. Confidence without humility is arrogance, but people want a confident medical provider. They do not want somebody that is unsure. And if you're unsure, refer them to where they should go. If you're unsure because you're like, ooh, we're getting caught some weird stuff, I really think it would be best if we got you over to this provider first. Here's why. We want to make sure it's not any sort of underlying thing that's going on. Then you shouldn't be here because maybe it's symptoms coming from something systemic, which happens. And I've sent plenty of people away that I needed them to make sure they didn't have some sort of systemic thing going on because they showed some red and yellow flags that, they didn't belong in my office. That is called being a good provider, right? That's called being a primary skeletal, musculoskeletal healthcare provider. And that's what you want? Awesome. Then act like it. But if they're not inappropriate for your clinic, then be a professional and tell them what your opinion is of what they should do and then shut the hell up. Don't talk so much at the end of your visit. Tell them your opinion. Be quiet. Let them decide on what they want to do. And then you can talk to them about what their options might be. But don't talk them out of making a decision. So that is the solution, right? You're selling the solution. You're not selling the plan. You're not selling the package of visits. You're selling the why. Okay? Why? What do we need to do? We need to get you back to running and help you manage weight so you can look great in your bridesmaid's dress. Here's what I see, okay? It's probably going to be 2 months, which is basically what it's going to take up into the wedding for us to get this pretty simple issue resolved. I expect to see you this many times during that time. We're going to work on these things for you at home. We're going to talk to you about these things in the office. I'm going to hold you accountable to making some of these changes because they can be kind of hard. So I'm going to be your accountability partner, which will dramatically increase the likelihood that you actually do it. And we're going to get you there. Your knee's going to feel great. You're going to look great. This is what it looks like. That's it. You're selling them on the why that they have with the appropriate solution to their problem. And it's very important that you go down the route of plans of care and getting people to commit to a plan of care because in our experience, if somebody's going to drop off, it's usually going to be between visit 2 and 3. And go figure, if you're pretty good with your hands, you're probably going to have significant symptom reduction after 2 to 3 sessions. And this is where somebody who is the average consumer, not a medical provider, they think, this person's awesome. They solved my pain in like a couple visits. I'm good to go. I have nothing else to do. Like, fantastic. But we know the problem is not solved. So when it inevitably comes back, they're going to think, oh, this person only got me like temporary relief. Like they really weren't that good. And yet you didn't have a chance to actually finish the drill. You never finished the plan. Like that is what's frustrating about not being able to have somebody commit to a plan of care. So getting over the frustration of the sales process and the fear of that is something that's very important for you to do, not just for your business, but for the outcome of this person. If they're saying they want to do this, and for many of the people that come and see us, like I said, they've seen other people and they have not got the outcome that they wanted. That is something that you got to pin them down. You got to get them to say, this is what's going on, and I'm going to make this change, and I'm going to be held accountable. Because when you pay attention. And when you have somebody that is laying it out for you and being a part of that accountability process, which is a big part of what we do and what people will pay for, by the way, people find a lot of value in accountability. They do not find a lot of value in you spewing a bunch of information at them and just giving them an overwhelming amount of crap. That's what you think that they find value in, but it is not. They find value in clarity, accountability, and simplicity. And if you can take them through that process, you're going to have so many people get amazing outcomes. It is going to catapult your business because they're going to tell all their friends and family about you. It's going to make marketing very easy. And it all comes down to you getting buy-in on the first visit and them actually understanding what's going on. It's the most important visit. It's like there's no other visit as important as the first visit. And you don't even have to do that much, like hands-on stuff, teaching exercises. I've had plenty of visits where I literally didn't do anything besides listen to somebody in the subjective, do a very thorough objective assessment, and educate them on what's going on. And then it was like, look, today we got deep into what's going on. We narrowed down the root cause. And here's what we need to do to fix it. And this is what we're going to do the next couple sessions. And here's what we're going to do the next couple sessions. You can even lay that out for them as to what they can expect, right? And that's very, very good for them to understand what the path forward looks like. And when someone is clear, they're down to commit. And when somebody's confused, they're not, right? And that's just the way somebody makes buying decisions. Imagine if you're confused. What if you're going to buy a new car and you're confused? You're like, how many seats does this have? What kind of engine is this? Like, what are my financing options? Like, if it's not clear, they're not going to buy it, anything, whatever it is. And the medical process is even more confusing because people don't know what's going on. You're talking to, teachers and accountants and, people that work in sales. You're not talking to other medical providers. You've got to keep in mind this. You have to keep it so simple and clarify things for people. Clarity, simplicity, accountability. These are huge things that are so valuable and important. And they're not the medical things that you've been taught to do on an assessment so much, but yet you're already going to do those things. Just make sure you don't put too much weight on your, 20 exercises you want to give this person from the get-go, or however many different manual therapy techniques you want to do. Like, so you can save that, spread it out. Don't do so much up front. Okay. So, in summary, let's go back through this real quick. All right, so number one, take the easy wins. Use their name, show up on time, build rapport, talk to them about it, about how they got there, where they live, their family, like little things like that it's a human-to-human connection, okay? Get to know the human a little bit. Don't forget to ask them how they ended up in your office. Who told you about us? How did you hear about us? That's huge for you to help with your marketing, to know what's working, and to reach out to somebody if they refer them to you, to thank that person, to write that person a handwritten card, by the way. Thank you so much for sending Brian to see me. I really appreciate it. We're a small business. We don't have a big marketing budget. This means a lot to us. Thank you. That goes a long freaking way, for God's sakes. Like, you want to get more referrals? Do that shit and see how many referrals you actually get. Subjective. Listen to the person in front of you. All right, let them tell their story. Let them get the frustrations they have out. Ask why questions and go a couple levels deep. Make sure you're asking them, why is that important to you? Why now? Like, why is this timing important? What's going on? And they'll tell you. And now you know what you can actually talk to them about that reiterates why they need to do the hard work they're going to have to do with us. Because physical therapy, delayed gratification, painful hands-on exercises, weird little exercises, or painful hands-on manual therapy, weird little exercises, and then delayed gratification to get the outcome that they want. That's hard to sell. Okay, so you got to know what you're tying that back to in order to get them to do that. On the objective, be thorough like you would normally do. Test, retest are a great way to dial in, what's going on with somebody, and seeing is believing. If they can see something change for better or worse, if they can see range of motion improve, even though we know it's temporary, like, we're not trying to sell somebody snake oil or whatever. We're trying to show them that we understand the human body enough to be able to make these temporary changes. And it gives us a better idea as to what things we need to work on with them long-term to make these long-term changes where we can improve their symptoms and their range of motion. Educate. Use something to draw, right? The I3 model. Take it, like, steal it, please. This works like a charm, and it'll help your sales process. But more than anything, it'll help with you getting buy-in and people actually understand what's going on. And isn't that like the most important part? Like, somebody actually understanding what's going on and being clear about that is so rare in the medical community. And if you can do that, you separate yourself from everybody. Like, everybody that they've ever seen, there's going to be a huge difference in terms of their experience with you, their customer experience, the way you made them feel. People remember that. So the I3 model: incomplete mechanics, mechanics lead to incidents, which then lead to injuries. Explaining that to somebody or whatever, use whatever terminology you want. I don't really care. Like whatever you do, if you want to split hairs in physical therapy, which we love doing this shit and telling each other why we're wrong about randomized control trials, is whatever bullshit you want to say. I don't care. Put whatever you want in here that's going to make sense to you and your methodology so that, we're not in different camps of how you're going to explain this stuff. But this is how I like to explain it. And this makes a lot of sense to the average person. Okay. So incomplete mechanics leads to incidents. Incidents leads to an injury. In order for us to stop these small injuries or incidents from occurring, we have to fix incomplete mechanics. Here's what we found that are your incomplete mechanics. Once we solve those, we resolve the injuries long term. Make sense? Cool. Home exercise plan. No more than 1 to 2 exercises. That's it. You can't do more than 1 to 2. Don't give them 3. Give them 1 to 2. Ideally 1. Give you one thing to work on. Okay? Here's what we're going to have you work on. Get really good at this. We're going to make sure you understand this. And when we come back together next week, we're going to layer on from there. We're going to build on top of that, right? This is the foundation. Give them a pop quiz. Okay, when you get home, what are you going to tell your significant other is going on? How are you going to explain it to them? Because they also are going to have to explain to them why they probably just spent $2,000 with this person to solve a problem. And it sure as hell helps with buyer's remorse when you follow up with a homework email, which we'll talk about in just a second, like a homework email that reiterates this, as well as making sure that they can articulate that to you and they understand what's going on. So follow up with a homework exercise or a homework email that's details with the visit, whenever, what you found, what the next steps are, and gives them, whatever maybe it's the home exercise that you showed them, or it's like access to, a app that you use for homework exercises, whatever you're doing to actually implement that. Everything is in there. You're following up with a summary of what's going on and then what the next steps are and how they can do the things that are their homework, right? And then the last thing is make sure that you are talking to them about the solution to their problem and you're not talking to them about, the actual packages that you have necessarily. You're talking to them about what your medical opinion is of what they should do and why they might want to actually commit to a plan of care if it's appropriate for them. That's the other thing. It should be appropriate. If it's not appropriate, then don't bring it up, right? Be ethical with your sales process. And the truth is, the vast majority of people that come to see us, they don't have something super simple going on that's going away in a couple of visits. They probably do need to work with us in a plan of care because it makes the most sense for both parties. But if they aren't, then don't bring it up, okay? You have to be, consistent with what you're doing. And it should be based on your medical opinion of what they should do, not necessarily on what business, solution you want. And this is going to make a lot of sense too. When you have staff that you bring on, you have to be consistent with them about what you expect as far as ethics are concerned. And there can be some lines blurred here with businesses where it's this is better for the business, but this is maybe better as a clinician and what the patient wants. Always pick what's best for the patient, period. Okay? But don't undervalue what your worth is either. Because I can tell you, for a lot of clinicians, just because they don't know what to do with somebody long-term when they're not in pain, it doesn't mean there's not a lot of value there. So that comes down to education with you and your staff. But always make a decision based on your honest medical opinion of what they should do. Be agnostic to the cost of it. Okay? This is what I recommend. Here's why. Here's your options. Which would you like to do? Don't talk them out of the sale. Don't talk them out of the decision. Let them make the decision. And that's it. All right? So if you do these things, there's very few things that I can teach that I think will improve your business more than a rock solid first visit, the way you set it up, the way you follow up with that person, and teeing up the next visit, because this is going to help your outcomes as far as your patients are concerned. This is going to help your sales percentage dramatically. Okay, we didn't even talk about sales processes or sales training or anything like that. If you do the first visit right, it's sales easy. It's so easy. And this is so paramount. This is a foundation to everything else you're going to do with this person and any other interaction you're ever going to have with them for the life cycle of them working with you. They're going to remember this, and you're either going to leave a great impression on that person, or it's going to be, it's okay, right? You don't want to be in the middle. It's probably not going to be so bad they're going to tell everybody that you're terrible, but you want to be light years better than any other health interaction they've ever had, which is not hard to do because most healthcare experiences suck, right? So you doing this is going to put you in a top 1% they'll ever experience in healthcare. And if you can do that, this is going to be a massive, massive improvement for your business, a huge win for you and your staff. And it's a process you continue to follow and improve in your own business in a way that makes the most sense to you. But this is a great outline to follow. So I hope this helps you. I hope that you find value in this. If this is something that you find valuable, I would 100% recommend going to physicaltherapybiz.com and take a look at other resources that we have there. Learn a little bit more about our team, learn about how we're helping literally hundreds of clinicians all across the country, and how we've added literally hundreds of millions of dollars of revenue to cash-based clinics across the country over the last few years. The stuff we talk about works. The stuff we talk about comes from our own practice and our own experience as clinicians. Like, I've treated many patients this way. I have a degree. It's right there. Like, this is my world. And I just so happened to open a business and found that this is an interesting thing that I actually really enjoy. And I enjoy being able to help a lot more clinicians be able to do this well. But if you want to really experience what it looks like to work with a group that has helped thousands of clinicians and is teaching things that are not only ethical, but also very effective, go to physicaltherapybiz.com, take a look at what we have going on. And if it makes sense, pick a time to chat with one of our advisors and they can dig into your business with you. You want to see where you benchmark across all these different business metrics that we look at compared to the hundreds of clinics that we work with. We take you through our business bloodhound assessment and we show you exactly where you're doing well and exactly what you need to improve. And you can leave that call with so much fantastic information. So that's it. I appreciate you watching this and listening to this. Danny Matta here again, founder of PT Biz. Until next time, enjoy this information, apply it, and hope it helps your business.